Today, now the 1st of February 2021. Happy new month. You believe say just yesterday we been they say Happy New Year. January we don't say Tata Toram. But people in glad the way January don't go. Because some people say January, it's like say something then day it can get up to 75 days then. If you know how the struggle day, you go understand. But today, we on Dr. Bingo Salon and under the Sierra Network Charity Foundation, bokutin dem bide we happen na salon. And you know say, where somebody left go, where you come, if you can't go nani. And today, Doctor get for can't go nani, for can't tell we how he pass na salon. But before that, we go up more small. But waiting happen na Connaught Hospital today. The acting Minister of Health and Sanitation, when Dr. Anthony Sandy, he said in wake up this morning, in think about Connaught Hospital, and he just feel for do an unannounced visit na Connaught Hospital. But he said na two things and goody. One, now for check the successes where the medical doctors and the nurses them don't they get na Connaught, and two, now for check the challenges them where Connaught Hospital don't they get. You as a Sierra Leonean, we don't they hear about Connaught Hospital, also be little or nothing or more about Connaught Hospital. If you want put the success and the challenges, whose one you feel say go full up about it? As a patient, as somebody where they work there, as a porter, or whatever you they do there, as somebody say for they pass now the ticket, whose one you feel say go full up quick, and maybe say if you go run over you get for take more. Are the challenges or are the success stories? Okay, we go carry but as we carry on, at any time we go just come with doctor, then Ingo can tell we how it pass na salon. But for now, make we check the COVID-19 status updates. We know say yesterday we not been there, so low peep waiting be happen yesterday. Yesterday the labs them say na 1,041 tests them na in they analyze. And we know say on Sundays it can be a quiet day for the past month for more than begin for analyze testing. But not so for yesterday. Yesterday that be 1,041. Out of that 1,041 days, 65 be turned out for be positive. 65 be turned out for be positive. If we want for break the 65 down, Western area urban 34, Western area rural 24, Bo 1, Moyamba 1, Pujeon 1, and inbound passengers 4. And that one they give you 65 for yesterday. Hope you did take note. Today we get 848 tests them now in the labs them analyze. 848 tests now in the labs them analyze. This now for today, the 1st of February. And we turn out to get 41 new confirmed case. 41. Out of the 41, Western area urban 36, Western area rural 4, and Bombali 1. And that one they give you 41 new cases we get for open we eye. Because yesterday 65 to today no more 41. 106 stand right away. Alright. So because of the 41 we get today, the cumulative confirmed positive cases they reach 3,634. For the past 24 hours, we still stand at 79 total number of people where we don't lost to COVID-19 because we don't get nobody where we are lost to that. The one them with the in isolation 1,226. Like I said, if not to foresee government be done they say now people in the self-isolate and all these other things them, I think we've all run out of bed. But 1,226. Cumulative recoveries don't reach 2,329. The one that made in quarantine now 464. The one that we don't discharge from quarantine now 13,661. Now the numbers then this one. But you know say Ivory Coast, we need for each everybody. And if we want to touch Ivory Coast, we just get for go through Mano River Union. And for Mano River Union, Salone 41. Guinea 71. You want for your Liberia? Oh, my man. Liberia 221. This I tell like all the other one they wouldn't be they keep for the weekend and just had all thing for Monday. Then they serve we. Liberia 221 positive cases. Ivory Coast, per all way all man they pull chest now by the numbers them. Salone 41, Guinea 71, Liberia 221. Ivory Coast say no they can hear me. Ivory Coast 233. Now Ivory Coast think with. Still yet nobody no passer. Nobody. So the Mano River Union countries them for today. As the people and they say, oh my God. Yes, now this Liberia give. Liberia just add all the one they wouldn't can keep. All the one they wouldn't can keep. Now Liberia add for we. So you know what thing? Make we just go on all thing. Because on our for make. So for today no more the Mano River Union countries. Now 566. 566 now the Mano River Union countries then come out today. You know, sometimes we can take and make fun, say, oh, this and that. Africa need for wake up. Because even in Ghana, even in Ghana, they self their numbers then they go up. The numbers then they go up. Nigeria numbers they go up. We hope saying at the second and last wave this. But let's come to the number of deaths. Salone 79, Guinea 82, Liberia 84, Ivory Coast. Ivory Coast don't lost 2 persons today. Yesterday now be 152, today now 154. We pray say all the one them. There's 399 people that now would have lost to COVID-19. And soul them go rest in peace. Okay. So now that's what we get from the Manor River Union countries them. Matter no be saying na December travel caused the COVID-19 increase. Africa wake up, COVID deo ide Madina to Din na in say that one day. After talker say in sure say there must be success stories. I agree with that part they say there must be success stories. After talker, I fully agree with that. I make us say what do you think the success and the challenge, which one? But the other part we say it's not that bad. I don't agree with you. Connaught Hospital, it's that bad. Yes, there are success stories because definitely it's not going to be wholly, solely, and fully just everything like that. Agreed. But that one way say it's not that bad. Na Connaught. Connaught is that bad. But anyway, the acting health minister inspects Connaught Hospital. This is through the Ministry of Information and Communication. I say the acting Minister of Health and Sanitation, when Dr. Anthony Sandy, we know say it don't change. You remember not so. Dr. Austin Demby did it now, but I don't think he don't take in portfolio yet. So now he make we get this. One way they act right now. Okay? So the acting Minister of Health, Dr. Anthony Sandy, on Monday, 1st of February, be pay an unannounced visit at the Connaught Hospital. He say he want for inspect the facility, and also he want for engage the workman them, and also he want for engage the medical doctors them, made them tell them their challenges and also their success stories over the years. Over the years. Eh? Okay. Accompanied by Uda, the Chief Medical Officer, Permanent Secretary, Procurement Officer, and a host of other senior staff them. Now the ministry, the minister and entourage, now the hospital care manager, Dr. Dao, now him be receive them. He take them and conduct a tour of the facility, starting with the dialysis unit, which has been equipped with 5 brand new dialysis machine by the government of Sierra Leone. You be no say dialysis units day we don't begin for work in Connaught Hospital. Well, you don't know now, in case you not be know. Dialysis units where the government of Sierra Leone don't put 5, eh? Not to 1, not to 2, but 5 brand new. Kudos to the government of Sierra Leone for that. After a brief engagement with officials, the team proceed to the ICU unit. Then, when they accommodate, they go to the operating theater. When they accommodate, they go to the children's ward. When they accommodate, they go to the free health care unit. When they accommodate, they go to the cost recovery pharmaceutical unit. So then take them around. Just in case you don't know. Then take them around. You don't hear all side and go no to so. Okay. Then from there, then we get frank discussion with the medical doctors then. Wait, Salomon tell you say frank discussion. What in that mean? Then talk all tonight for the no to so. Alright. Then talk with the medical doctors then talk with the nurses then, the matrons then, and other senior medical personnel na the hospital. Now, in brief remarks, no more we make Dr. Russell, we na a consultant cardiologist na the Connaught Hospital, he be highlight a variety of issues them where he say they affect them work na the hospital, and they be urge the minister for look into them urgently. I don't know why I make the Ministry of Communication try for play smart na ya. Then try for play smart in a way where they no agree for talk the thing them where Dr. Russell say. Then just say a variety of issues. Me for be don't like for me them put them variety of issues then they, so that we go know exactly within na this variety of issues. But hey, varieties of issues, not so. Make we continue. Okay, varieties of issues. He say the government for look into them urgently. He maintain that Connaught Hospital now the premier hospital in the country, and there is need for government to pay more attention to it now than ever before. The acting minister in response expressed profound appreciation to the staff them and say then they work day and night for ensured for say we get quality health care. Na public hospital and a salon. The government they do. He acknowledged the most of the issues them we then discover for say they not be get idea, they not be get any knowledge of them. Yeah. He acknowledged that most of the issues they discover were not to their knowledge. The minister na talker say most of the issues them we then discover they not be get idea for her. So even though we don't do program then I say what they call for Connaught Hospital for make government pay attention. So Connaught Hospital with all in strike them we then doctor them be don't complain. So that one day back they not be get attention, or then just one put on the outgoing minister say then be they tell and I not be the talk. Hey, salon. Okay, he say I was shocked at some of the issues raised. Now I make a tell we na just no say I feel I'm the ministry not put waiting Dr. Russell say, but instead they tell we say. Now the acting minister say they not be get any idea. Then the acting minister say in shock. But wait yeri me you know. They're not going for tell you. They say variety of issues. Okay. It is good that I'm here to see and hear from the senior doctors them, me self. Because that previous minister will be there. He busy they go for launching them. Who say don't want to see them say the previous minister, Dr. Alpha Wuri, he been going to Connaught Hospital for pay visits, for go hear waiting and they talk there. He get that time there. Now then go put now na education. Good luck with that. We will summon an urgent meeting this week with the management of the hospital so that some of the issues raised are addressed and laid to rest, Dr. Sandy assured them. The acting minister urged the hospital management to give detailed explanation on the challenges faced by the hospital as the president is concerned about the facility and will want to know exactly what is happening there. So this one tell me say, there is a reason why Alpha Wuri is no more the Minister of Health and Sanitation. If the president is so concerned for say, now he make he send, so this unannounced visit self, now the president send it. He's saying do an unannounced visit, but now they say the president is so concerned. They want a detailed explanation of what they go on a Connaught Hospital. Hey, rather late than never. Not to hear will be done the ala. Not to hear. So if the president the thing don't reach her now, hey, what two people can say? Ala tanto. But no one left you. Yes, the message don't go. Okay? He say, then go address them issues then they. Okay. The chief medical officer, Reverend Dr. Thomas T. Samba, he be encouraged the senior management of the hospital for join the acting minister and in team at the ministry for me then discuss some of the issues raised. Why me could not tell with the issue ya una self? Now just the number of some of the issues raised. Alright. No problem. Now they go. Statement and updates were given by Dr. Joshua Coker, head of the surgery, Dr. Boima, Dr. Air Leby, where Naina the pediatric surgeon, and Dr. Sako Kabia, among other people that will be talk there. Okay. I'll let they marinate small, yeah? Because we on Dr. Naya. And been go salon. So, you need for can tell we I pass. Make we bring and come on board. Make it can tell we what he do. Yes, Dr. Aissatou Kake Jallo. You get the platform now? You can take over, ma.
Good evening, everyone. I hope everybody did do well. And I want to say, thank you, AAA, for allowing me to come in today, just for share with you we do where I've been going now. Freetown, because I've been there salon, but at Freetown, I've been there. I not go any other place. But we try to reach out to many people them, for show say, Sarah Network Charity Foundation. We talk about some projects them. So as I've been just to say, for the January 2021 Sarah Network Charity Foundation being reach out to different, recipients them for give them where we feel say really not can get the help we they're supposed to get. We can focus on school issues them, the elderly people, some people that we seek, we can reach out to them. And in that we can also decide for, do some health education at different communities them. And during this trip, for Unawedi Fala Sarah Network, media things and ways set in schools and they go through where we feel say really, as Sierra Leoneans them, we need for come on board and see how we go help. And hopefully with that, the government and the Ministry of Health, education, then all go see say, what we country really they lack so many things and where they need for come up and try for change anything and then not the face of the people that in different communities, then we really they struggle, and I will just share a presentation slide here because this is not something we do every time where we do a donation. We want for go about it by explaining what thing we really do so that everybody go know say, who said and they put their money, it makes sense for let them put their money there. And we they try for show that transparency, which we they always advocate now. So for people them for the do na salon and with the hope say with what we they do so we will get more people there on board, we will join we for we continue for do better things in Sierra Leone. So let's see, they see the slide up here. This slide would really would they try for display now today, now for gear report for the January 2021 donation where we do as a network, as a foundation, and as Sierra Leoneans, them when I see this as something, it might be small, it might be new, but now something we want to continue. And in how can we do that now through now support through all Sierra Leoneans and for come on board and for really join we in how we can really make this happen, going forward. So currently, we status, many of them I don't know, we get a 501c3 status now the United States, we get an account where we say they would Citibank, where now they if people can donate, now they would put money, not that we have a lot of money, but whatever we have, we put it there, we use it for the causes them way we want to do. And in the year of 2020, we've been doing some donations them where we always remind people them for say we continue for let them know say this not the thing that we don't do and we will continue for do more. So this screen on that they see, so they just show some of the donations them the previous donations that we don't do, where if we say I'm not going to spend too much time on this because I don't talk about it, before, but, that's just to tell you, that we have done that and we will continue to do more as Sierra Leoneans and as a media platform, as well as a charity foundation. That's now one thing, we for embrace, we hope say people that will join we and like what they do and no say what they do here, now for we country, now for how develop Sierra Leone. Projects then we reach out to, we reach out to like right now, currently what do they do? The Renovate school within the Sierra Leone Muslim Brotherhood. It's a primary school within our Old Field Street. The structure needed a lot of help, and then we reach out for single help. And as it is right now, Sierra Network Charity Foundation, they took more than what we don't plan to we will take on, which was like 70 to 80%. But as it is right now, it seems like we're going to be doing more than that because the structure, then they try for strengthening them, the roofing be done, and we don't share that now as well. So where Abidede will be do a follow-up, twice, the very week where Abidede I make a follow-up, that video will come up on YouTube very soon. But I've been do another follow-up with the concrete, with the pillars and they take place, now that video they want to watch, which we will watch later on today also. And the Peking baby Mary Sise, where it be say we don't talk about in case now, so we raise some money, we been raised about 1,100 and change. But we don't spend some money for do a CAT scan, do a doctor's visit. But during this trip, we been need for do an MRI, where it be say based on that MRI, the doctors in India, because Sick Picking Project, they help me with this actually, for see how they will help facilitate for raise money for the surgical intervention, because it born with kyphosis, scoliosis, which is an abnormal congenital deformity. Initially, they've been feel the picking for them, but after the scan, the initial X-ray when we see, I say no, this is not a fall. This became born with something with a congenital defect. So that way, now the MRI don't really show say yes, this is not something we're born with. But if as a child, she's just 4 years old. If they not do anything for this begin right now, as they grow, this growth now the back will continue, and that will affect many different things, for them. So basically waiting at the cost of the surgery, because we don't get a report back from India. That report, through Sick Picking Project, the young connection for reach out, it will cost about $12,000. $12,000, that's just the surgical cost. That doesn't include, the trip, and the time we get for the day and all that. That's not something we will come up with and raise money along with Sick Picking Project, and with the hope say, other people that will join we in how we will facilitate that particular picking day in surgery. But the MRI was done at Sharon now with WhatsApp group for let people then say that happened. And also there's a photo of me and the picking where I've been going to ECOMED with him, and along with Ishmael Alfred Charles, we're now the one in charge of Sick Picking Project. And then we reach out to a school called Step Forward Academy, where we in a school where AAA we CEO and founder, when Amioko, director for Sierra Network Charity Foundation, we don't this support. You don't do a lot of things then because a community where inside the leaf, you don't do a lot, just looking at the video and talking to the young man who really start the school now, the community for ensure they begin and get school. Not the area for let them learn, because we talk about education, we really need for educate everybody in a salon, even if they don't get any other education, but then forget that basic education take to high school level. In that way, we can really develop the country. And then this young man come up with this, and AAA be done to support this for a long time now. And we as a charity, part of the Sierra Network Media, really feel say we for continue the work we AAA don't do. And we're not going to just stop there. As it is right now, that the young man, they mention some of the constraints them way then you go through, and then really need a structure or place who say, that we would try for see how we could help. But at the same time, we really they call on government, for see say that area they need for support this school. They're not, for just take a look at it as if, and somebody just start I don't know, they left no, when you see things like this happening in your country, as a government, as a Ministry of Education, you really need for come on and see what you go do as a minister or as a government for say, what, this community need help. So let me come in and help. Now that we do, and we reach out to them as well. We do a donation to them with a sum of 4 million leones. In some of them, we donations there, no matter how little it is for us here living in the diaspora. But for those people, those were significant amounts, and they are very much appreciative of what you don't do. So we want to tell everybody thank you for that. And we also reach out to the war wounded. Now, Rokel community, where we say, talk to the camera, reach out to these people. Them, and during that time, they would and reach out to them. We see say they need some help. So during this week, January donation, we reach out to them with a sum of 3 million euros. And we really want to see how we go able to get school furnitures them to schools, and we really they suffer that, lack that. But how we go do that, we really need some people that way they do this work, for local, maybe work with them in partnership, and for we do a little bit of donation to different communities that we need help, because we can see now the media or now some videos that we're picking and this are gone. That's very sad. And I don't feel say how you go land. We say you say this don't self where you do too. You don't get desk for right. These are some of the basic things and we will feel say government need for focus on. And but as a charity, we just go for do your best. We're not going for just say Papa past government do this before we do anything. Then we move on to 2 other charities. Then we'll be reach out to we sometime October, around October, November-ish. They want us to help them. Then we want to help them, with some money, or some kind of donations. So I wrote a letter, we send it out, that we would reach out to them when the time is right. At that point, we were focusing on other things. And we did that while reaching our salon. And before I left, it be the part of the agenda, the projects that we will need to accomplish for 2021 January. So, that now Girls Advocacy Network, formerly known as Kids Care, and also Care Foundation for Better Sierra Leone. We reach out to them for each of these foundations, then we give them 3 million leones each. And then, we reach out to the Senior Citizens Home in Grafton, which now the King George's, the 6th Memorial Home. We don't reach out to them before. Some of us see this the way being streamed live. We reach out to them at a bigger money at that time, 2020, but then Phil say, what will come up with this trip not match, but they have still appreciate what you do. I be there with one of the panelists, Tony Ture Jones, I will see, in the next few slides, where him be accompanying me to, the donation that will take place, like the first donations, then we'll do the first 4. Tony Ture Jones be there with me, and that was really nice to know, for find somebody where we all talk at this platform for let himself day for be part of this. We want to tell and thank you for in time that day, and also the entire team, for within themselves be do. And then the last donation we'll do now to the Step Forward along with the National School for the Deaf at Wilkinson Road. That school they, done there for so many years. They need so many things, and talk to the camera, we also go to them, for find out what in themselves they face, where it can to, school materials and supply. And with that, we've been there, and that school there, I will tell you, for me, I see it as not just, any picking where they did. I see it as me own picking day. I get a nephew where they go to that school where, I feel say every picking at that school, they go through the same thing with my nephew they go through. So we've been reach out to them, and because the headmaster been mentioned them constraints within the need, then we need a vocational center, because when them picking them finish this school, actually, then they find it very difficult, especially when they don't take the NPSC exam. The one that we do well can continue, or they're not able to do well in secondary school. So then feel say they need a vocational center. A vocational center, that way they, they can able learn skills. And, in this presentation, I will show you some things that were by, from them, like, the one that we know past the NPSC, we just now vocational things, and they do very well there. And we really call on, we government, we Ministry of Education, that school na part of the ministry. In that said, they need for see how best then we will, because they get the land, they just need the structure up, but let them get a vocational center. So as you see on the screen right now, I share with Una, we banners them, I travel with, which, I had to get that on ground. And then, for Step Forward Academy, the 4 million loans check will send, a National School for the Deaf at Wilkins Road, War Wounded at Wokel Community. And then also, you can see the next slide, here they show some of the images, them, they with we reporters, them, some of the recipients, them, the seniors at their homes. We chair lady, Ajafanta Kake, we can represent, we another on ground. And also Tony Ture Jones, who I will see in the picture there, with the first donations. And then, you can keep going. And this now another image with the school, the National School for the Deaf, where you see the teachers, them all in the uniform. They were very happy for what they receive, and the school picking them now the classroom. And also, if you can see here, we get some of the recipients. Then this now the Care Foundation for Better Salon, and this one the Girls Advocacy Development Network when our kids care. Then we reach out to we, and we try to reach back to them for sure. Say yes, we do appreciate what they do. We commend them for the work, and all in presentation there will get a media coverage way being take place. We just need them to be transferred, and then eventually, they will be on YouTube very soon. And then again, here you can see over here, this now the people them now the war wounded. You can see this man with the walking stick, the lady also then lost a limb, so that could tell you they really need help. And in here, the school picking them with them very much happy with the check who present to them. And this now the Sarah Network, media team, along with the Sarah Network panelists, them here, I will see, Connaught, Isa 2, Abib and Seal, and I believe Solomon, the other one. If I miss his name, I'm sorry, but I know I try to know everybody. So now then why are they being talk to the camera, where they really do a lot of things, and where would they see now the market and the people that are the communities, then what they go through. So we want to tell them thank you for what they do, and we hope say we continue to work as a team, and for make sure say we really highlight things that now we can't see, we will go make salon go before. And then here you can see I engaged the coaches them at the National Stadium, during the traumatic brain injury presentation, where I've been reached out to John Keister through Mr. Husfred, in contact and connection. So I've been reached out, I do a presentation there. That was also streamed live. For Mekuna say this trip ago, it was all about Sarah Network. All I was doing was Sarah Network work, even though it was a time for me to have a vacation. But it's just the work of humanity. And also here, when I will see the young Peking, where they talk about, baby Mary Sisse, na Mama this na Alfred Charles, and this na me here with the mask, that's all my pictures, I try to put it down a little bit, but sometimes I have no choice but to keep it on. Again, right there, on that is some of the work them within Peking and can do. I just took one picture. I have multiple things that where I buy really where it be say, then they do very well, then do keychains, then they do like, some mats, them we will put on your dining table. Those are really nice, so we support them, giving them the vocational center where then really they ask for, you will do well, for them picking them, we know the area, we them picking them, we know the talk because of, then get a disability. Just because you get a disability, means we will execute your skills. So we really hope say this now something we will catch the eye of the Ministry of Education and the current president, say them for come on board and help them with the school system. Yeah. we not a charity foundation, we can only do so little, but the government gets a bigger role for play. And this not just a presentation where I do now the Ministry of Health along with the Sierra Leone, the Okada riders, them now upgone, and also we print these handouts because it's not handouts. We now from the presentation slides, we just pick few things them where we feel say we go catch people their eye, people then go look back and read them and say, you know what, oh, if you get traumatic brain injury, these are some of the things we need for look out for. So the people then be very much engaged and be interested in knowing really how we go do a bigger presentation for like multiple Okada riders them take place. Because we'll do a survey, me personally, I go out now Waterloo, Rokel, and Joe, and me and my niece, then followed by a friend, Arun, my niece Salima too, and me in friend, Wena Arun. We did a survey, we targeted, 195 people, 62% of Okada riders do sustain traumatic brain injury. So that's how significant it is. So that discussion there, again, when I've been see how that take place, with the Ministry of Health, along with the Okada riders, we be the hope for present to the Sierra Leone Road Safety Authority. We've been getting an appointment and make a visit there. I was hoping that I could do the presentation before I leave. The schedule didn't take place. So with the hope, say, with the email that I sent before I left, they will reach out to me so we could even do this virtually. With the hope, say, we want to continue to do this, and then I continue for talk about this again, other platform when at the AYV that morning day, it was a last minute set schedule, but we made it, because I was really exhausted and tired, but the work was done. This now for say thank you to everybody we donate on behalf of Sarah Network Charity Foundation. We want to appreciate every single donor, no matter how little your donation was. It made a difference to people them we receive them donations than what we do. We want to tell on our thank you. We want to tell the team Nasalo thank you, along with we self now, so where they do the work. We want to say thank you to WISAF, and we want to tell with family members and thank you for allowing us to really stay on the computer, documenting and doing things that would take you away from your loved ones. So I want to tell me family, then me loved one, then I just was really thank you, because I know exactly what I can do now. So I take too much time away from them. But that said, I want for just also share one thing here, the letter what I received from the deaf school for tell we thank you, and really tell we thank you for the fact say, okay, I'm gonna stop sharing the screen, and I just wanna show you that letter. Then send out a letter of appreciation to tell we thank you, say they appreciate what you do. So, and I do wanna read that. For the entire team here, if I'm able to make this bigger. This letter now from the National School for the Deaf, so within the letter really the states here, it says their motto, which I really like, it says deafness cannot stop skills, okay? And this school done it since 1963. This now from the head teacher in office, Mrs. Wilfred Kamara, where he said to we, on behalf of the chairperson, members of Sierra Leone Society for the Deaf, the head teacher, staff, and pupils at the National School for the Deaf, I want to wish you and the entire organization a prosperous 2021. I express our profound thanks and appreciation to you for your most generous donation of 3 million leones towards the welfare of the children. Congratulations on having extended your generosity to the National School for the Deaf. The children were overwhelmed by your generosity. We once again thank you very much for your kind considerations and wish you all the best in 2021. Thank you and God bless you. Sincerely, the Mrs. Wilfred Kamara Cole, when are the head teacher for the National School for the Deaf. So as soon as they see some of them things they do, means a lot to many. And we feel say we want to continue for they do that. And we really want to tell una all thank you for what you they do for Sarah Network Media, Sarah Network Charity Foundation, and the radio. And Lord continue for support. We CEO and founder AAA, because for people like me to come on board now, because it gets a platform like this, where it be say it will allow me for do what I will do when I the work of humanity. And as I do that, I want to tell Usfred thank you, for everything we do. We get other videos them we'll go for put up. We reach out to the Epilepsy Foundation, now Rukupa, and also want to tell Abiba to K Kaba a lot of thank you. Now them be done the work with me before I leave to Sierra Leone. Now then don't really work with me for low share ideas them in how we will really present traumatic brain injury na salon. And we want for say thank you to the other panelists them, Mr. Usman Tolly. I've been get the opportunity for Rufiam during this visit. So I was so excited that I see some of the people them where they hear them voice, where I really see them in person. It visits me and we spend time. And also I see Mr. Tony Ture Jones. I want to tell them both thank you for everything what they do for this media, and Lord continue for support the radio program here, because what we do now advocacy. I believe say that we advocacy day is don't not underrate that. That's a big thing. And all the callers them, all the listeners them, all the donors them, then everybody we can come once in a while and contribute. We really want to tell them all thank you. And we want to tell Abdulem Fatoma thank you, because instead of doing your own bit of help in how this we networking go forward, you can kind of share things and with we. And I've been get the opportunity also for visitor in office. So, I did a lot of work, in terms of who side go. So AAA, I want to say thank you. And I think me not get much again for add, but in terms of one thing where you talk about, but before I do that, there's a video really I would love to share these things because I think now that today program I really want to focus on the work that I've been doing at Salon. Give me just a minute, sorry, don't they forget. So for this now, for the one them we not being able for watch. Okay, we Salon farm with them, Dr. Isa to here. And then the Sierra Leone Muslim Brotherhood, where we try for do a renovation, a project we on the advocate for see like other Sierra Leoneans join we for see say we don't complete the roofing really. This now like the pillars then when they try for put in place for strengthening the work for make sure say the structure is safe. As you look now this video, we don't go around just for see really the work is needed. We need a lot of help. We need people that let them come on board, let them help and support what they try for do here. We as Sarah Network Charity Foundation, we don't do best. The alumni themselves, some members then don't do them best, then time, then effort. Give them your own little bit of contribution. We believe say, if we all come on board, we go really continue for do well in how we go strengthen this school building for make sure the school picking them come back and engage the school. So as you can see, this now something something this now what we done they work on, so you can see again right in front of the school. So we get a projection date where they hope say we go accomplish through help and support other people that join we as Sierra Leoneans for now we go strengthen this building and make sure say the structure is safe for school beginning at this school. So I will revert the camera so that there is a work going on, the roofing is complete, and we're really hoping that other Sierra Leoneans can see that this work is all our own to work together in order for us to keep this school safetyness, also like how the picking them deserve for land, the environment for be safe. So when I can see, so I wrote them, Sansan, the pillars and they up, this all were done, in addition to the previous pillars, them when I can say this now newer version of the pillars, them. This now like another surveillance on the work where they go on, but there's a lot of work to be done. So we really they call on me, fellow Sierra Leoneans, join us, Sierra Network Charity Foundation, along with the SLMB alumni, for the renovation project hold on start in November. We really hope they will complete this in February. A lot is going on right now, so we really want for everybody come on board and really support we. And by donating, no matter how little it is, we really will appreciate everybody in your help. Thank you very much. And again, Dr. Isatuka K. Jallo, the lead director for Sierra Network Charity Foundation, and we want for say this school complete by the end of February of this year. So in the next few weeks, we really see how much efforts and the workers then go do, as well as because we want to keep that 3-month time frame we'll give, and even if we not get the exact date, but like within the February month, we want for the school complete, picking them occupy the school again for do the walkway, the need for do as students, because one for the now host now they study or now inside the mocks the school picking, then they go land, because right now if you see that mocks that I just show you, now they picking and they occupy at this moment for let them go land, let them go let them not fall behind, because school day in session, and then need for really do their school work, and the teachers then also they wait on us. So their Salon Fambo they wanna join Sierra Network Charity Foundation, really work together. We will really do best for Salon and do what's in right for this school building here. Thank you very much.
Yes, I know the motis. This is the level. Just one thing on the end, balance what they are.
But why the upside, even for them be nice, let them they pave the side of them, they and they pave while they are in the walk.
Well, say they therefore notice they creep. So the contract they advise say that they don't fix the building, or the building where they notice again. They get sound. So you say no advice, all the by the right round, then they begin notice up, and then they advise. But if you advise them back for no week.
Now for just fast track the work.
Okay, yeah. Now next week you may say they will start up because this week they never done this. But now we from somebody contract to one well, I make it.
So what's in there say about the windows there? When?
Yeah, the window, the beginning, the not the beginning today. It's an almost complete.
They don't do that? No, I mean they don't build, they don't finish that. You get her?
The doors they don't build the doors. The next one they start the windows. So that's even for complete the doors. Can't be
or then they are, or then they are
no, they're not at the workshop. Or like no, they're not saying that they use for. So for can't be the windows, I'm going to come with the windows.
But no work now they go on right now up, eh? Anything they go on?
No, not the office. Now And then pillar, this step, and then the other 2 pillars. But what the blue step and the instrument of one, so the roof is not already. So we do the step, say the 3 days. You just want to do the 10 days. Because you don't say before they broke, if you don't turn, of course, all the ones are there before they put this in.
Okay. Hello everyone, Dr. Advocacy here. Just a visitor school Waterloo called Step Forward Academy. So I just come for do discussion with the one way we found the school and school way triple on the support. So we just want to see what they go on now. So and then you can see with me, I get Mohammed, and then behind there is another Mohammed. So we can just briefly talk. Okay, so we get one classroom here with students, and then over there is another.
The secondary GSS 1, 2, and 3.
This is GSS 1, 2, and 3. So we can really see that
City accommodation.
the accommodation is not easy. Okay. Hello, everyone.
We are standing up.
Okay.
Meeting.
Thank you very much. Welcome. How are you guys doing?
We are fine, thank you. How are you?
And what class is this one?
That's 5 and 6.
Oh, wow. You're getting ready for examination soon, right?
Yes.
Okay. Well, keep it up and do well, okay? So you guys are the future leaders of this nation, right? Okay, very good. That's just okay. You're welcome. You're welcome. Hello. Hello. Good afternoon. Good afternoon. How are you guys doing? Okay, very well. So what class are we talking about here?
This is J1, 2, 1, 3, 1.
So this is the junior secondary school class. Okay, they're all combined. We can really see how it is. Okay, very well. Good luck. So do well, stay well, and we hope that you guys will be the future of this nation. Thank you. You're welcome. So now they see, we go around now each classroom. The classroom then combine them just for see how not easy it is to talk about quality education at the nation. These are not quality education at the nation. How we go change this as Sierra Leoneans them. I believe so we can do that going forward. Good afternoon. How are you guys doing?
We are fine, sir. Thank you. How are you?
Very well, thank you. What class is this? Class 3 and 4. Okay. So we're having a combination of classrooms just to get things going. Okay, thank you. This is the nursery school we get into. Hello. Hello. Hi, everyone. Okay. So, we go count. Una sabi count or we do ABC?
Stand up and read ABC.
Which one would they do?
Stand up.
Okay.
I read ABC.
So,
C E F G H I J K L M N O P Q R
All right, impressive. Thank you very much, and keep that up, okay?
Read one for me.
Little baby goat.
Little baby goats, white to one and dog, must be careful, they fall down bomb.
All right. Very good. Excellent. Keep that up, okay? Because who knows? Who wants to be a doctor?
Doctor, we don't want to be doctor.
Who? Who wants to be a lawyer? Okay, we are not decided. Not a problem. Down there, it's okay. Okay, we need a lot of that, huh? What do you want to be?
Lawyer.
Oh, okay. All right. Thank you very much. Okay. Okay. Very well. So as we can see again, now nursery Dande, we had classes have been combined. See a combination of classrooms, either 2 class in 1 or 3 class in 1. For giving students they have the opportunity for make them go really learn, let themselves get the benefit of education. But I believe say Mohammed here will talk to you a little bit more about some of the constraints them within the face, and we'll see how we as Sarah Network Charity Foundation will come in and support in any little way where we can. And at the same time, you know, AAA don't be the help with this school for some time now, and we feel say we will continue that light as long as we get the need to do so. So, but definitely, Lord, we see what we go do as Sierra Leoneans, as the government, they pledge for free quality education. But with this visit here today, I did not see that. I think there is need for help, there is need for support for us to go forward and to really improve, and the classroom should not be combined. That's not how we went to school, and that's not how anybody should be going to school. So now that I get for say, Mohammed, what's in some of the things that we really challenges them for Unannounced?
Okay, well, actually, mommy, like one of the what we get now, a place business. We don't get a place where we go call say this now we own.
Okay.
We get this land because like you don't be the making foresight. Or they don't pull we don't disgracefully left for place. I don't be the number 4 side. Things not really easy. So then at the first challenge and the way we be facing.
Okay.
Yeah. Because looking at the whole community, there is no school within the community. So we decide for not bring up this kind of idea because the community we deprived. Even some of the beginning and people them na caretakers there, some man stony the bro. So we decide to for create this initiative for the community, at least for all able to eradicate or minimize the literacy rate within the county and the community as a whole.
Right.
Then secondly, like the sitting accommodation really, you know really easy furniture for school. They will call say yes, yeah, na school. Where we are in Alexa, somebody come, no ask again, but it will definitely say na school and facilities and they know they in the school.
Okay.
Yeah, because like now don't say and say this is now the 21st century now. They say the world more modernized, like at least speaking themselves or they do this computer business because it don't spread now the whole world.
Yes.
They don't get any facilities like that really. When the teachers there are young, vibrant teachers there, we devote can push this initiative logo before there is no payments, no day.
Right.
Out of voluntarism, then they do not really easy. And some then they get family and the school not too much.
Right.
Like so they demand not to school fees, not to anything, at least for the upkeep.
Yeah.
The school because some stakeholders in the community want to have a call and bring them on board. None of them no show up, nothing pass. AAA.
Right.
Then come into the rescue and they call it secondly, like some of the picking them back, then they come out too far. Some they come all the way Campbelltown, some they come out different side them, really easy, and some people they are less privileged. People then some are orphan within the school here, so like really easy. So go out, all carry we as the young guys then, or able to develop, do something at the country as a whole, because not over the community no more with the ground. So if I can mention some of the constraints in this, we'll be facing what they go through.
Okay, thank you very much for that. And I will continue for doing what they do. And we now a non-profit charity organization with a part of AAA and media platform. and we go see what we go do as a charity organization for see how we're able to give your own little contribution. With the hope say, the government will really see this school and try for see how themselves go come in for really help with some of the things them this school. So as we done there is a little bit of some of the things, and even looking at the structure, we're going to say this not really a school facility. This not just a place, a temporary place for let them will get education at the community. As the founder, I don't talk, some of the things that would they face, I think say this not something we really need we help. We really need all Sierra Leoneans them for let them come on. But most importantly, the Ministry of Education for really look at this school and try to develop a school facility in this neighborhood here. So we hope say that could happen, and we really tell everybody thank you, all the one that way they do something also, and we will really do what you're able to do. So I will stop the video for now. I will try for talk a little bit more off camera with Mohammed, and then I will get AAA on the line. Hello. Okay. Just back. I think watching that video. I know I'm not the only one listening right now or watching right now. You feel say I will do something. Easy. Sierra Leone, we country need a lot of help, and we feel say we can do your own little bit of help. As Sierra Leoneans, we for all understand say what we do, now for help humanity. There's a lot of things where we need for get now we country where we know say we not get. But every little bit of help where somebody can do can make a difference. And I think Nine Sarah Network Charity Foundation, they do, because all that matters for us at Sarah Network Charity Foundation or Sarah Network Media, na salon, nothing else. Everything else is secondary. That makes on 10 and day. People like me, when I come on, when I see people indulging in corruption that really affect how people then they live in a salon, it gets me not only angry, but I get emotional. And sometimes it's not because I'm not strong enough to change things, but these are things that we want to follow with government take care of, because something anyway individuals then will do, but there's certain things the government really need for one. Now then your responsibility, Dandy. So for now, all me they say, we were at this platform, we were part of this Sarah Network Charity Foundation, the WhatsApp group. And if you not been joined, I think say 2021, a year we want for join we, because we too don't start, so we get for continue. We get better plans or bigger plans than we want to do, not to just health education, we I will say that I get for focus on each time we're in a salon or even we're in a, along with the other one, they already do their own bits of work. And we will continue to reach out to people them will feel say they need help. But in order for us to continue to do this, for meet the mission statement, they will put out now a website. We need people that support. So no matter how small, donate, please come on board. We need Una, we need everybody, Me, it's not just my time, it's not just the money. I sacrifice a lot to do this. Now because like sometimes when you do certain things, you don't know why you do it initially. You ask yourself why, but not a calling or not a God name push you for Dwam. Initially, I always would ask AAA, why am I so drawn to him? I would ask him that, but then I began to learn, as we start for work on the charity. See, now that's make I'm so drawn to him, because I'm sure he has the same passion that I have for Sierra Leone. Because, even if you tell me, say, Salon do something wrong, I will always defend the country. But while I'm doing that, I want for sure say, you don't know why you do it initially. You ask yourself why. The basic human needs, not a calling, or they always cry for, they always talk about. And we hope, see, with our support, we can do that. And currently, we get the SLMB school project where they go on. We need a lot of funds, a lot of money. We don't put money in there. but we still need help. And with all the other things that we get for come up for this year, 2021, we need everybody in support. So I want to say thank you. And I hope say we all stay safe. And we hope say the new thing that we want can at Connaught Hospital, then come to reality. Because sometimes there is something you hope say it really come to reality. So now that I hope for, and I'm sure now that everybody they hope for Salone. Thank you very much and stay safe.
We want to say thanks to Doctor. We all in a little bit of learning process, so so we not can go on video that much. I make you find out so they get one or two things then, but hey, we get things covered. We get uncovered, How can someone qualify to join the foundation? Famoro they ask. Famoro Kuma, I think you don't say now, yeah? For make how somebody can able be part of the foundation. You just need for donate. What you donate, you don't be part of. We are all part of, but say every side you get the inner core. So if you want to be part of the inner core, make you know what really they go on, then just donate 1 thing no more. Then you go able for come and be in the WhatsApp group and see how things them they be channel and now we they do everything where we they do. So you don't get opportunity for Step Forward Academy. Actually, that was not the name of the school where I meet them. I meet them and we get another name. And I meet them then we get a different uniform. After getting myself involved, we end up change the name of the school, give them Step Forward, because I just been believe say actually na me come up with the name. I just been believe say something good go happen for them one day. So we get the Step Forward Academy, then we begin for change the school in uniform. Be then at one place, come out today, give notice, throw a bench. I think I be come here at one time, call for help. People then come on board, and at one time I get like almost tired because it's like you try for help now, one problem after the other. But Dr. Esa to come on board, they say, no, we have to continue this. You don't start them, so we have to continue. And we will see. We hope for the best. We hope for the best. I think now so the beginning begets me back home. How much people who the beginning don't get here right now? I remember the time then they visit me now, host visit me like then just want to make I go pay a visit to the school. Let me just go pay a visit to the school. I don't count 1 thing 2 times. So the other time I was like, okay, let me go pay a visit. That's it. And when I go and meet the Pekin then day, like the nurse get picking them, pass through that. But I believe say your atmosphere melt. That's how I got hooked. And I think say doctor back don't go, then people in back don't see. You don't get hooked, but there's a lot needed to be done. Sarah Network, we try for talk the talk, walk the walk, do the do. So it's not like maybe you have a reason not for trust other charity foundation we associate with Sierra Leone. But we try for show you see Any say we will put remote, any say we will talk. Hey, something good supposed to happen. You put your money, you join the group, everything. I believe, see, if you didn't order Sierra Leone Foundation, Charity Foundation, I don't know how they work. I don't know how they do. But you yourself go and agree with me, say, they try our utmost best for be transparent in how your money go, how you see. Dr. Duncan talk everything. We don't see. We don't hear. So it's up to us for take on the mantle. We talk about the Connaught Hospital visit, not so, and also Dr. Duncan give you this presentation. So it's up to us. But we don't want for left and so we need for raise money now tonight before we come here. You don't see, you don't hear. The SLMB school, you see the project. Doctor not talk, but I want to tell you, say, we be anticipate, say Network Charity Foundation be anticipate for give up to 5,000. As it is, we don't spend almost 7,000 now. Don't spend $7,000 in fixing that school, and you know, see furniture no can inside the too. So when we ask, we still need we for show up. We need we for show up. Yeah? But make we come with whose friend, make we hear about the Connaught and doctor in presentation within a young contribution. Yes, whose friend, you get the platform, sir.
Yeah, thank you very much, Triple A, and thanks to all our listeners and viewers. And a big thank you to the doctor for all an excellent job in order for able for put things together. And even your initiative and even your initiative we bring in terms of able for raise financial sources them so that this thing will be successful. So all that we thank God for that. And as you say, you listen to the inner man or inner self, the voice to talk to them. So I only hope say God will continue for direct time for listening to that voice. And so that it will show and we self will implement them together with all those that will take part. We thank them very much. And looking at the helping of people in the salon, we know say it's very vital. If they try for reach, it will finally reach there. But it will take a while. But the while what they mean, not depending on waiting people then will come on board. And especially back those them we concerned for open doors so that things then will go easy. So that we thank God for that one day. Looking at the area now, the hospital in business with the visitation of we acting Minister of Health unannounced. There's a lot of issues them where I suggest say God will make it kind of hit for let go look into. And make we take say now that the president sent we accept that. Make we take say okay now somebody been paid deaf ears. Make we take those things. And then make we see now, waiting in now, don't find out from all these challenges. But the only thing why they pray, let this visit not be once and a single visit, because in this type of situation, this institution are a different institution. These are health institution, we are a tertiary one, we are the big one for salon, and we get few them. So waiting in the try for do, if we try for implement a regular visitation, if not in one forget first class hand information for no. We don't know, there's the skeleton, and then gradually it has to make a continuous follow-up on those bases, not just to start it, so they admire and then you get for leave. Because as I always say, this is a marathon, not a sprinting. So we get for take the pace of running that so that it go able for reach in goal. So he go look, say, he get things that we get for the beginning, they look at it. Because when you talk of a hospital or tertiary hospital in particular, the things that we think, say, okay, what about the patients then they put first? Think about the patient then they put first. Because that's the main thing about hospital. And you put in the patient first, now there you therefore begin to consider, say, how are we able for reach? Why are we able for reach the area where the patients now they put first in any of this area? Now forget the resources then. You get the good type of physicians. You get the exact amount of people who want a ratio who they work there, like let's say the porters. You get the one that will get immediate contact to the patient, what are the nurses and the healthcare professionals. So you can forget these things on board. And when you get on board, there is an area where you go look, see, now this area where we get for show, waiting and waiting and they expect. Then while away, the people in back when they can't visit, they expect. So the citizens and the people who are the patient, they expect for get a good care, like rather than they can't do. Because as they open that door or they can inside that gate day, or they knock at the entrance, what then they expect now for let them go seek comfort, and then they go look for a person where they go assure them for say yes, and when a healthcare professional for tell them say you go feel okay. Not to go tell and say far from it, if they can't die you or will not go able to sick, but everybody they go to the hospital either for alleviate the way you want to feel the health bit of it, and then you reduce the sickness panel, you assure that patient day. So those are the things that we get for look how they think they are get for be restructured. Because where I read that side, if you look at the past government, what they do, the present one now. Upon the first one, don't forget about that. What happened recently, there has been an area where in this work body where they deliver this care to the patients, they send them for go land state registered nursing. Because they've been inside this UNDP funded program where for the anesthetists where they do now cottage. So some of them not been get SRN, but they were lucky to get the scholarship. So they do SCHN. So for let them go able to learn more, they don't sponsor them UNDP, and some others who have been helping in the hospital, we don't apply for do SRN. So there's a number of them now for go do state registered nursing. And this came about from a program known as this global funding. This global funding don't they fund Sierra Leone for the past few years. So now then they help them for pay for them, and then they try for CC, they're able for learn in that particular SRN. So when you work, because they don't do the UNDP, then they work at the hospital Connaught, so they expect a salary. But when you go study as a student or any environment self, then they will take it called secondment. That you they work, will they pay, you they learn, will they pay for you with small. So the global fund was paying the tuition fee. So but because they were working, they're not going to get a direct bursary. So they expect, say, then a workman then they go get them paid continuously. But they never took their allowance while they were also working and going for that period of study. So time Connaught was saying, let me take this so-called leave. They leave money. So they leave money now, then go request for an individual. So now they leave money, would they give now, would they let the government assure that one day, but they are entitled to leave money because when they take the leave. So they can get this leave money in lump sum of some amount of million euros, 3.5 million each. But the unfortunate thing, now the government don't turn around and say, now, when they study under, we will not get forgive una leave allowance. But when they study, they ask workman them. So if you don't give una this leave allowance, una get forgive it back. Not for saying I learn to. So now they are taking this money, £700,000 each every month from these students who are studying. So these are the things you try for look, say how this therefore help the country. We are in the people who therefore deliver care. They are not able to be enhanced. They never study. They don't give them what they're entitled. They say, well, we'll not forgive now because of these reasons. And I can't still understand it, which I'm trying to find out, because I define as I go bring them up. But these are the areas where they therefore look into. They therefore also commit excellence so that the people that will get excellence. And then they foster that culture over there between people and goodwill one and their behavior towards the patients, and then when they care and deliver medication, so they go able to come into one side. As long as that trust, you get that communication, then you go begin to see things are going to be working. And then you come out to the area where they talk about the technical area, because then the physical condition and the sound technology will get for daily. You get for get a diverse medical staff. That is diverse medical staff. People that want to treat endoscopy, people that want to treat for general treatment, people that want to treat for bones, people that want to treat for urology, people that want to treat for other infection, so on and so forth, departments. So it become like what you can call say something of the whatever they call them. But the idea is those are the areas they get for look into, because we been get some of them, but some of them have been taken to areas where they are useful, but they are not beneficial to the government. They are useful where they sent them, but they are not beneficial to the people there in terms of what they do. And this is an example who I will give one of the ambassador to Germany, one of Dr. Bimba Lamin Bayo. He was the only orthopedic surgeon who been get. I've been working with him during that time of the war because they are teaching them, they are teaching. Now, in one with a Dr. Babawa, that they treat those stumps. But he was now being used to go as an ambassador to Germany because he been go land because of the language. Now for that say, which is good because he's going to communicate. But is that beneficial in his area of orthopedic? An example you will see when I'm picking recently when you see around the video. What happened with that picking? The picking, there is no better care delivery because you go for X-ray. The X-ray they tell the picking say don't fall down, you don't broke a rib. The X-ray they tell and say nothing not happen with you. So you see the delivery care again because you don't get the right people that will get for tell the picking the truth. They lie here. So then get for left the treatment, tell the thing down from abscess. Just imagine a rib get for common, it appear out. But those are the areas the care not deliver now. Who then get for do operation, when a minor operation, when a bone specialist, they are not there. The only possible I believe and say where they I think say that somebody when a one new Mr. Lavalley or something, when the other second orthopedic only way they did. So these are the areas where you think of, say these are the things the government get for look into so that they will get a good balance of inpatient and outpatient. The patient that way they come, they will admit, then you get the one that way they come in and out, all those areas they get for look around, so the management it will become very strong. But as long as the commitment not there, that excellence not good in, then the trust, all those kind of things. But I only hope say these are the things where the man will get for put in table. It's quite a big challenge. But it's very easy to be moved forward because like the global fund, will bring them later. There's a big issue within the experience now with the Salon government. But all kinds of fraudulence. But all the ones that left for today, I expect them will think about doing all these things as they bring them in place. Thank you very much. Let God continue for blessing the Salon. Thank you, sir.
Thank you very much, Usman.
You're most welcome. Yes, sir.
Yes, sir. Make we come with Usman Toli. Make we waiting in get for me. Yes, Usman Toli, welcome on board, sir, and welcome back.
Okay, thank you very much, Triple A. And I will start by thanking Osfred for that wonderful submission. And then I will thank you as a CEO. Without you, all this will not have been possible. And then I will take the opportunity also for thank Doctor for the wonderful presentation. And I really get short time for meet with him. And I regret I not be able to participate in some of the other events them due to unforeseen circumstance. But clearly, the presentation, it show clearly speaks volume. We don't see the fantastic job where Sarah Network they do, and it's really, really exceptional. And now on them basis here, we all come day in and out for listening to Sarah Network. We believe in the fundamental values, the principles of humanity, the principle that we all are one, the belief that Salon go better and that through we own effort, Salon will grow. Now on that basis, the fundamental principles then they make the kaya for come listen at the same time, make we own contribution we able for make. Clearly, as you can see the presentation where Dr. Aissatou Dongi, there's a lot to be done. There's a lot to be done. And fundamentally, I believe, say, in as much as we want we country for grow, now some of the things than this way, I believe, say, we all get for put hands on deck for all we push that country go before. It's not about you self no more. It's about we all believe that for push that country to go before. There's a lot to be done. You can see from schools, institutions, them, all other country they need help. And what to make a country be a strong country, become a successful country, now where the institutions them, they're strong. And when we talk about institutions, it boils down to schools, it boils down to governmental institutions, private institutions, you name them. Now they're institutions, then they make a successful country. So I would say kudos to Sarah Network for the fantastic job on they do. And I believe, say, if we all join hands on deck, now that's a low need in order for lobby go before. Not to all time for can criticize the country, talk about a whole lot of other things that will not go well. But ask yourself what you yourself can do for your country. I think that is also important. Unlike other forums, them where you listen to them is all about criticizing. But ask them, what can they do towards the progress of a country? And this is why, for some of we believe in Sarah Network Foundation, because at the same time, we analyze issues critically. We are critic. At the same time, they see some of the achievements them where the charity they make. So in the likes of Dr. Isatu, and the likes of Osfred, and the likes of the CEO himself, I think we can say kudos and to everybody where they participate, whether morally or financially. I think we all did at the right platform. Then for go to further, I just want to talk a little bit on the visit of we acting Minister of Health. I think one of the things they talk about is this. When the President, His Excellency Julius Maada Bio came to power, clearly we see he been make some unannounced visits. I think we all been very hopeful, because I think that is what we need in our country. That is what we need. The country, the institutions, both private, mostly, public institutions, to be honest, are so relaxed. We all remember when His Excellency the President came to power, one of the measures them we institute was that everybody for go to work in time. Everybody for go to work in time, which was very lacking in that country. And time is a very critical factor towards success. We all know that. And it is a critical aspect towards some of the strategies them in order for make a successful institution. We give kudos and day. He also they talk about the announced visits and what they make. Those are the two critical things them will be expect, say this administration will take forward. But as time goes on, as usual, we country with a drop down, we they take on things, but later on we relax them. We know they see that much again they happen. People begin the absent for go to work, people begin late for go to work, and then go back to square one. Them visit here, they are very important. Not necessarily the president. Yeah, because the president gets so much function, so much, things them to perform. But you get heads of institutions them where I feel say, once in a while, let them just pop in to some of the institutions there. Let them know how they do. From there, then they're able to find out what are the challenges then, what are the successes then. How can we go about to deal with the success or the challenges then? How can we do more to improve upon those successes? Those are the critical things then where a fundamental aspect of we administration for the think about. we have to say it will help the country move forward. And clearly, AAA, as you clearly state, there are so many challenges. Although, somebody said, we have some, achievement. But when you look at it, maybe achievement you could say is only about 10-15%, as against that of 90 to 85% of challenges. So there is a lot to be done, AAA. Yeah, and Sierra Leoneans, we all know it needs somebody for push them, say go do this. So one of the critical areas then I think government for do is forget head of institutions then for do a monitoring process. I think one of the things that we lacking clearly from all the institutions then is that they're not the monitor. They just left everybody for go what you want for do. And when that happens, there is a tendency for what we call moral hazard. People relax. They take risks. They relax, thinking that it's all fine. But if we don't government them for land for continue with this sort of monitoring process, because now when you monitor people and they, go about for do implementation, you get for monitor those implementation for ensure that what we hope for, what we achieve, they're able to achieve them. But if you relax, it's not possible. I remember even His Excellency the President ATBO come. He said he want the diasporans then. He want the diaspora for go work in a salon. Then they ask what he mean. He said because for we the diasporans, we are used to time. When he say no need for, kick post, he say get for go work 8 o'clock in the morning. Because we are used to it here. That's how it works. That's how, a successful community, a nation work. You expect your time, you perform your functions well. You don't need to be, as long as we continue to do that, to be honest with you, a lot of this corruption where they hear about is due to lack of monitoring. They're not the monitor, they left everybody for do. And we clearly listened to the 2019 Auditor General's report. Compliance is one of the major issues then. And what they bring about lack of compliance, they're not they monitor them. Because if you go do something, I know regulator, I know they ask you don't take this receipt, what you do about this, nobody asks questions. Consequently, the system be breakdown. And this is exactly what we are seeing here. So I will stop here, Alan, no bother now too much with information. But all I can say is that I think Sarah Network, they produce the result based on the fundamental principles of humanity, of togetherness, of justice, honesty. Those are the values what we all yearn for. So I thank you very much, AAA. You're doing a fantastic job. Keep it up. Dr. Jallo, you're doing a fantastic job. Met you in person, and I know, very nice person. We spoke, though for a short time, but I'll be able to deduce, say you're not a person with a good personality, So let's keep up the good job, and I will stop here. I'll give chance to other people. Then thank you very much, AAA.
Thank you very much, Usman Thole.
Thank you, sir.
Yeah. People that don't begin answer the call, people that don't begin donate, please, you will just donate through Cash App. Can you please send us a text so we will get your number? Somebody just donate through Cash App. Please just text we so that we'll go get your number. Please. If you want for Duam, as people in the ask, Cash App or Zelle, United States number, then at the screen now on your side, you go see and there. The Sarah Network Charity Foundation, we don't get a report card from the lead director, Dr. Isatuka Kejalo. We go salon. We go salon for do other thing, but Sarah Network overwhelm. Sometimes we'll try to buy biscuits for her. See, I need to overwhelm am so. And all you see every day, go live, do this, go up and down, even to the last minute. Like she has to do something. But to one for say we really appreciate everything. We do. We know they take that for granted, you know. More we know somebody they do work diligently. But we're here. I believe say now so like minds them, all they intertwine together, so that at the end of the day we go able to create the kind of salon we want. We're not going able to make a want him, but when you come to like Sarah Network, where they show if they say transparency, would they show you how it's supposed to look like, you know? If they say now for this, would they show you how it's supposed to look like? We talk the talk, walk the walk, do the do, lay down the lay down, sleep the sleep, gap the gap, you know? Just like that. The minister, acting minister, we're gonna Connaught. Back to the matter. Because me I not be there with him more. He say in shock. For all the complain who then complain na Connaught Hospital. Even though the Ministry of Communication I still get a beef with them for that day when they no agree put waiting at the outline where Dr. Russell outline. And just say it took various things then, varieties of challenges. Waiting at the variety. They not agree for tell we. Eh? Hey. So, who they wait? Sometimes they keep and sometimes that media house been they will not keep. Say, Doctor, I have to say, well, in team in a media say, but I say sometimes we go get biscuits. He said, I contain a biscuits now. Thank you. Aya we dey, na na salon. Lunge bridge, can't find now, get an aya. That is it. You get the bridge. You get the connection. No safe. Ibrahim say the government for land from say a network family for talk and do and back them up with transparency. Matayanobi say the acting minister he been shocked-ties. Now he talk how he say I was shocked. You shocked? Connaught? Ha? Well, okay. Who do it like Dr. Austin then become? Do it like because if you don't begin shock then they say thing they not in a Connaught. But hey, they say dialysis. But you see, if now go and send talk to the camera, they not go angry just now. For me to go also go check how the system they work. But that each salon, all the good. Let we see all the 5 brand new dialysis machine where the government don't put na Connaught Hospital. We needed that. Now we need the CT scan. We're happy. We have the dialysis machines. We got a dialysis center now with the poor people, and because they have, but my dear, the way out they charge in a salon and then private one them. But let's not talk too fast then because we don't know how much Connaught they charge. That's true though. We need for Connaught how much Connaught they charge for us. Then obviously na 10,000 or 20,000 less they make their own as compared to the private one them. Because this government you then good. Then good for for let them tell we compare the private sector as to infrastructure development to the locals. I make a say for give music. No, I don't so they can't lock here. In fact, the phone line don't lock safe. But as I talk, we don't get 2 people that don't donate through Cash App. And please, if you just donate, please send away a text. We just want your number so that we will send text back to you. Because you know, say Cash App will not know the Cash App or Zelle will not know the numbers them. We don't get two people who don't donate through Cash App, and we really appreciate. We want to say thank you. Welcome to the family. And you say go come, you can join we inside the arena. Abaka Kauta says, AAA, are there any plans now or in the future to bring in the government official on this program to answer questions from members of this forum and take whatever ideas they learn from? Not of us only ask them more. But then they pretend for be busy. When elections end, they come. You see the all and they come. Just wait small no more, yeah? Abaka, wait small. At the time, will tell you in Sabisia and network, and the time will come for compromise for get triple position. So I can just play the politics. Just come on board. We ask you a question, you answer. We're done with you. You go. Yeah. Then they come. Anybody be they follow the previous election, 2017, 2018. Past former President Koreman, will not be interviewed. But even for the SLPP, they were here. So, they were left and so no more. You go see them. I tell them, go tell you, there's a Bisaya network. Alaji Sila, they ask for you, where you at? Eh? Mame Kamara, you will just talk about Alaji Sila. One for, because we get Alaji Sila don't appear safe. One for differentiate you small. With whatever, what you go put, make her they differentiate you. Because we get another Mame Kamara in the UK, and they will, you know in the US, they what part of planet Earth where you did? Eh? Mame Kamara, do you have account in the UK? If so, please let me know. I see. Maybe you say from UK back you did. Well, put something per you. Eh? Mame Kamara, put something per you. Go all that Mame Kamara back now. When you save then at the UK. Yes, we get UK account. You see, look at the green section, the numbers they already scroll there. We get a UK number. A UK number, the number they already scroll. Watch the number. Just send me a text, now that UK number, we go get back to you, eh? Send me a text, now that UK number, Thank you for all you on the way. We don't answer the call right now. Okay, Manchester, UK. Well. Are you whose friend? So we get Mohammed Kamara from Manchester. I know you by your profile picture with the comment. So the day we change her. Make an announcement, make a do say, people, I don't change you. Alright. But send me a text though. Send me a text, yeah? I so go love you. I so go left here for today.